Well, thank you very much, Henry. Let's see, does this work? Okay. Well, this is an important session, and it's something we all should be paying attention to in our hospitals. And of course, the challenge is how do we go about measuring quality and defining it for our patients. It's not a simple thing, and the classic things that we would think about in terms of our history with M&M conferences and examination of clinical outcomes are that desired medical outcome. But we have other things to think about in terms of the quality sphere: appropriateness, accessibility of patients to care, the affordability of care, whether we're using resources efficiently to provide that care and get the desired outcome. We see today these measures that we heard about from Kathleen about avoidance of hospital readmission as a quality measure. We've got a history in our own field of AHPB surgery of errors in the introduction of new technology that we should consider. And probably an underappreciated aspect of this is what Mike mentioned about the patient experience. Are our patients happy with the way their care was rendered? Were we kind to them, as he put it? And I think an under-recognized aspect of this is patient quality of life, that there have been very few studies in our field in this arena that we should pay attention to. Well, we have this historical Donbedian model of assessment of quality and approaches to improvement involving structure, process, and outcomes. I'm sure you're familiar with this. And as we think about how this would relate to AHPB surgery, we have some issues that we haven't sorted out in our own field. Ted Pappas, in his presidential address a number of years ago, talked about the workforce needs in AHPB surgery. How many surgeons should be providing care to the population of patients that we have who need that care? And what are the issues that face us in terms of the standards we think are appropriate in surgeon training and practice focus? What are the CME requirements for surgeons doing HPV surgery? Why aren't all the surgeons interested in HPV in this country at this meeting here in Miami? This is an important aspect of their continuing involvement